Your question is cannabis for bipolar disorder. Is there a magical workaround? Well, the answer is it is a double-edged sword. I'm Lex Pelger. I cover cannabinoid science. Ask me anything. I'm sponsored by the Cannabis Health and Research Initiative, who will pay you $100 to talk about your use of our favorite plant. Link in bio. You can also follow their newsletter for the best of all clinical cannabinoid science, curated by me every 2 weeks. Let's start with the bad news. You can pretty much summarize it with this review and meta-analysis of 25 studies, where they found that cannabis may precipitate or worsen bipolar disorder. Then in this Canadian review, they found cannabis use associated with worsening the disease course, decreased functioning, and increased suicidality. And finally, according to this review, all of this seems especially true for adolescents. Also, another risk that doesn't get talked about enough is that cannabis withdrawal can induce a manic episode. This paper is analysis of hospital data, but I also have a collection of case reports that are saying the exact same thing. So that's the bad news, and the levels of evidence for it are quite strong. But on the other hand, as far back as 1998, cannabis research heroes Drs. Lester Grinspoon and James Bipolar were writing about the anecdotal evidence for cannabis as a mood stabilizer. So when you hear stories of people with bipolar disorder using cannabis to downshift themselves for falling asleep, for quieting racing thoughts, for lowering anxiety, or to turn down their volumes on stress, it does make sense. It seems like acute intoxication can improve mood, while long-term chronic use may worsen disease course. So similar to people with schizophrenia in themselves or in close family members, people with bipolar disorder should use great caution when using THC-rich cannabis for controlling symptoms. And of course, there's one treatment option with early but promising evidence. In this pilot study, 300 milligrams of CBD isolate per day, which is a lot, for 8 weeks, reduced the scores of depression in people with bipolar disorder. So overall, you have a double-edged sword here. I think it would be okay to experiment with CBD isolate, but I would not try THC-rich cannabis without the supervision of a mental health professional or your healthcare provider.